So before we get started, I'm going to go over a few rules. Okay, first let's give credit where it's due. Hope and David worked very, very, very hard on this. We had to merge, we had to partner up with our sister companies, HD of Carolinas and Florida, and increased our team size. So as our team size increased, we got moved to a better bracket as far as insurance goes. And the offerings that HD Carolinas with the HSAs and the high deductible rate, deductible plans were something that we were trying to incorporate to kind of marry our policies together. So that is where this is coming from. I want to give a big high five and a thank you to both of them because this was a lot of work. Thank you guys. Anybody complains?
Does everybody know Hope?
Huh?
Does everybody know Hope?
This is Hope.
Hi, Hope.
Hi,
Hope. A little bit of background on Hope for everybody so she feels part of the family.
McGriff Insurance, formerly BB&T. We have been the brokers for your benefits probably for the last 6 or 7 years. So that's essentially, I'm your account manager, so I'm not the actual broker, I'm the account manager. So I do the day-to-day nuts and bolts. If you guys have questions about your policies, you have claim issues, ID card issues, those types of things, you can come directly to me. You can go to Billy. Billy will then come directly to me
That was
if
a
there are
key
questions.
thing. I don't know that all offices knew even the interaction with BB&T at the time or now where you are. And I know Billy's besieged with calls, and we'd like people to take it direct because it's difficult to put a intermediary between. You know, you're the authority on it, and that's the best way for people to get things resolved quickly. So
Absolutely.
just to have everybody know, that's why I thought it's you know, Billy's great, we all know her, but it's important everybody knows Hope.
Everybody say hi, Hope. Hi. Do not call her over and over again when you lose your insurance cards and you need copies. That's
Well, because yeah, we've evolved. We have we can do everything on our smartphones these days, so there's really no need to actually pick up the phone and make a phone call to get an ID card. But if you absolutely, positively don't want to go online, you can pick up the phone and I will get you a new ID card.
all right.
All right, so having said that, I did want to say Merry Christmas to everybody because Christmas is right around the corner. I can't believe we are actually getting this rolled out prior to January 1st. Like Billy said, this has been a process. Multiple meetings we've had with David, probably upwards of 10 meetings, going back and forth, just trying to figure out the best process to marry the Pace Adams with the Hobbs people, and then also make, taking into consideration all the people down in Florida and Tennessee. So we think we have come up with a really great offering for everybody. And the benefit of the market that you're in now is we're moving from a mid-market, a pooled market, to a large group market. And what that means is we're going to start to get claims experience, which we can use for leverage going forward to negotiate with carriers to get you guys better rates. So that's one good thing. The other good thing is we also moved you into the large group market for your dental plans. So the dental is a little bit better than what you have today, and we'll also get claims experience on that side as well. So we think it's a win-win for everybody, hopefully. The biggest hurdle right now is getting everybody in the system, and we'll talk about that as we go through this. So this is take one up.
Can we hold a second? Because I don't have any of the other offices coming on, Ryan. They're saying they're dialed into David Bryce's teleconference line, but nobody's hosting it. I know Billy ran it. They can see the slide, but nobody's hearing any audio.
When they first joined Skype, it has the option to pick Skype audio or use a different number.
They must have dialed into the 1-800.
I don't know anything about the other number.
Huh?
I don't know anything about the other number.
Yeah, I think that's what Billy, I'll go do that. Just give it 5 minutes, let's see what we get. They should have done the Skype audio, is what you're saying.
Yes. In the bottom right, the 3 dots. You want to pause the recording?
Oh.
I'll pause recording the first one. Yep.
Okay, can everybody hear me? Good. All right, so welcome to your 2019 benefit first thing is, we're moving to Anthem, but you're already with Anthem. The PACE people aren't with Anthem, so I have that on there. Moving to Anthem Blue Cross Blue Shield, adding 2 high deductible health plans with Billie and Hope.
We're having a hard time on the audio. It sounds like you're way away from the microphone, please.
Technology, can you hear me now? Okay, I'll stand right here then. Okay, so moving to Anthem, Blue Cross Blue Shield, adding 2 high deductible health plans, and then we're also, you're with Anthem Dental today, but we're moving to a different dental plan because we incorporated the people down in North Carolina. So you still have similar benefits. Actually, they're a little bit enhanced, and the premiums were reduced, I think, a little bit. And then the health savings account that we are going to be rolling out is going to be with Anthem. It's an incorporated, embedded health savings account with the medical plans. And that is through ActWise. Did I just air? So this is your one time, guys, throughout the year to make any changes to your plans. So if you want to add a spouse, drop a spouse, add a child, whatever the case, this is your opportunity to do it. Because outside of this annual open enrollment that we're having, which essentially is going to be for a week, I know it's not a lot of time, but you got a week to make these decisions. Outside of annual open enrollment, you have to have a life qualifying event to make your changes to your plans, okay? Life qualifying events would be you get married, you get divorced, you have a child, your spouse loses their coverage through their employer. That's a life qualifying event for you to add them to their plan, the plan here. Another life qualifying event that other people don't really think about is your spouse's annual open enrollment. So if you're enrolled here today with Hobbs and your spouse's plans become better or more reasonably priced for you, that is a life qualifying event for you to come off of the plans here and go on to their plans. You have 30 days to do this. That's a carrier rule. You can't come to Billy, 45 days after your child was born and say, hey, I need to add my child. I forgot to do that. The carrier will probably make an exception, especially for a child, but for a divorce or marriage, they probably will not. So 30 days if you have a life qualifying event. Okay? Questions? You can stop me if you have questions, okay? Does everybody okay. Yes. If they become eligible for their own employer's medical plan, that's a qualifying event. Okay, so
The speakers on that thing.
all of these services are covered at 100%, and this is a part of ACA
When they ask a question,
healthcare
everybody
reform
can
that
hear
took place in 2014. Is
For the
everybody
benefit,
getting all
I
of
went
these
to my
preventive
office.
services done? Is anybody doing
No,
any of
you
these?
don't have the conference call line working at all points because you have all the other people calling in as well to the conference and it's not started.
I do not
Tell them
under.
to dial back in using the Skype. Is that what you're
Yeah,
doing?
click on the Skype.
It's Tim Plum that people that are remote.
Yes, it is. It's active right now.
Okay, just let it.
Yeah, it's active.
Tell them to actually dial back in.
Are you guys able to see this
No.
presentation and hear it on the phone?
They're not.
Yes, if you use a Skype account and if you got a laptop and use a laptop speaker, it comes across perfectly clear.
The answer is no. These people are only dialing in via phone. They're not dialing in via Skype to watch the presentation.
Okay.
They're
We
only
have-
listening.
We have 3 feeds. We have one calling in, the ones that are on roofs.
Okay, all right. Going back to the 100% coverages, please tell me that everybody is getting a routine physical every year.
Guys.
It doesn't cost you a dime. It's free. Well, it's not free. It's incorporated in your rates that you're paying, but you're not going to pay a copay. There's no deductibles. They're 100% covered. Mammograms.
Well, yeah.
Routine
Yes, I've had
hearing
it.
screenings, prostate exams, colonoscopies after age 50. These are all covered at 100%, guys, and you really should be taking advantage of this because you could catch something that's a bigger problem before it's a big problem by doing this stuff. So everybody should be getting their annual exams. All right, this is really important. The pool that you're in today, you're kind of grouped with a bunch of other people that they don't really look at your claims experience. Going forward, January 1st, you're going to be in a large group market, and they're going to be looking at your claims experience. So it's very important that you do all of these things because if you don't, that's going to rack up your rates. One person utilizing the emergency room for their primary care physician is going to jack up your rates. So going forward, January the 1st, you do want to make sure that you are doing these things. You're asking for generic prescriptions. You're using the GoodRx. Have you guys heard of GoodRx.com? Get it on your phone. You can download the app on your phone. This will tell you, you can plug in your drug, the dosage that you're taking, and it will give you the price of that drug, 5 different pharmacies within a 20-mile radius. And you would be surprised the difference between a Walgreens and a CVS, cost-wise. And if you're on a high-deductible health plan, which you might choose to go into, this is going to be very important for you because you're going to pay for it out of your pocket. Did you have a question on the phone? No, this GoodRx is just a resource for you to use to see which pharmacy has the best prices. You still have your regular pharmacy benefits. Correct. We'll talk about the routine maintenance stuff too. That's another thing that we're able to negotiate for you guys. So the first thing I want everybody to do is make sure you register on Anthem's website, okay? For a lot of different reasons, but obvious reasons here. You can estimate your costs. You can download your ID card directly to your phone, so you don't even have to carry a paper ID card anymore. You can find a doctor from there. You can view your account claims, real-time claims coming in, medical claims, pharmacy claims. Everything can be done on their website. They also have a cost estimator. So have you guys ever walked into a car dealership and said, I'm just going to take that car right over there without researching? Nobody would do that. Well, do you do that with your medical? Do you do it? I mean, your doctor says, okay, you need to have this MRI done, and I'm going to send you over here to this facility to get this MRI done. Do you have to go to that facility?
No.
No. You can get on Anthem's website, and you can use this cost estimator, and it'll tell you, again, 3 or 4 different facilities within a 25-mile radius that offers this MRI, is in your network, and you would be amazed at the difference in the price from one to the other.
So I have a question.
Yep.
Like, sometimes Anthem, it's not really a question, sometimes when they submit the claim to Anthem will also help search within your network and give you a call before and to let you know that there are other people within like your network that can do it for cheaper. Yeah.
They've done that?
Yeah, they've
Yeah,
done it.
that's awesome that they're reaching out. But you can also just do it yourself, you know, with this cost estimator. So make sure that you register on this website. They also have a mobile app. Who doesn't have a mobile app anymore? So get the mobile app on your phone. And you don't even have to be at your laptop or at your desktop. Are you taking pictures of this? I mean, we can.
Not of you.
No, we can email this out to you.
That'd be fantastic.
Yeah.
The whole thing is
Yeah.
going to be sent off after the
Okay.
Well, I
meeting.
wasn't sure.
You're okay.
I can't write as fast as she's talking.
24-hour nurse line, you guys have this today. You're gonna have it going forward 24/7. You can get on the phone, you've got a sick child on a Sunday afternoon, think they have an ear infection. You could talk to the nurse can advise, do you need to get them in right away, or can you wait to get to the pediatrician the next day? That's available to you 24 hours, 7 days a week. How about this, Live Health Online? Has anybody ever used this? One person. Did you have a good experience with it?
Yes, my son had used that.
Mhm.
And my
Okay.
and we used it, and it was great.
It's awesome. Yeah,
Mhm.
it is. Well, it's the way of the future too. I mean, everything is, online. But first thing you want to do is you want to make sure you download this piece of it too. It's not just the Anthem app, but you have to download the Live Health Online. You want to go ahead and get registered before you need it. Put in your information, put in your medical ID card, basic medical questions it will ask you. And then if you ever need it, all you got to do is click the button. You get in queue with a board certified physician. They may not be here in Virginia, they may be somewhere else, but they're board certified. You can pick, I think you can pick your doctors too. There's like 3 or 4 different doctors you can choose from. And then you're sitting in a virtual waiting room, waiting to talk to a doctor. And he comes on, or she, and if they can diagnose you, because you're doing a FaceTime call, if they can diagnose you over the phone, they can write prescriptions and they can send it directly to your pharmacy, and you all do this in the comfort of your home, in your pajamas.
It was a Saturday on a holiday weekend.
Mm-hmm.
So it was awesome because we had the medicine in a couple hours.
Yep.
He was better, but.
Yeah, so it's great for things like pink eye, you got a rash, you're working in the yard, you don't know what it is, you got a sinus infection, you get them all the time, they can help you with that. The flu, I used it twice last year because I had the flu. Twice, I caught it twice. Twice.
You get flu shot?
I don't.
Is that covered?
Yes, flu shots are covered. Yes, they are covered.
All right.
But I was able to get Theraflu within 24 hours of catching it, and I was better within a couple of days. So it was very cool. If you are on the high deductible health plan, so if you guys decide to enroll in the HSA high deductible health plan, it's a flat $49 copay. You can't beat that. You can't go to their urgent care for a $49 copay. So it's a good deal. If you're on the traditional plans, it's your primary care PCP copay. Okay?
So this Live Health Online, is that something you recommend to us and our spouses get on? And then what about I've got a college student? Is that something you can also do as well?
Absolutely. Yeah, absolutely. It's the way I college.
Oh, no. I mean, that was you got sick this past semester. So
Absolutely.
Those things
It's perfect for that. It's perfect if you're traveling. If you're on let's say you're on the Health Keepers plan, and that's a regional network, so there's no coverage outside of Virginia. But if you're traveling, you get a sinus infection, you can use this as an option. It's $49. It's a great deal. So everybody needs to get this and put it on their phone. Future moms, they also have a program for future moms. So if you're pregnant or thinking about becoming pregnant, they do have a program for that as well. All right, so in Virginia, you guys have 2 network options to choose from, okay? You have the point of service, which is the Health Keepers Network, and then you have the PPO, which is going to be the National Anthem Blue Cross Blue Shield Network. So you really have 4 plans that you get to choose from, but 2 are on the Health Keepers Network, 2 are on the National Network. The biggest thing here, guys, you don't need referrals, but they do want you to choose primary care physician. So on your application, it's going to ask for primary care physician. If you don't have one, you leave it blank, they're going to assign one for you. Doesn't mean anything. You don't have to go to that doctor. They just want to have you affiliated with some sort of primary care physician. If you don't have one today and you go to patient first as your primary care physician, that's fine. You can put patient first on there. And they'll list that as your primary care physician. You don't need referrals anymore. So you don't have to go to that primary care physician to get a referral to go see a specialist. So that's all gone. But you do need to be very mindful about staying within your network of doctors. So if you're on the Health Keepers plan, you want to make sure that your doctors, the facilities you're going to, are in the network. Same thing with the PPO plans. Any questions about the networks? All right, so let's talk about the first two plans that are available to you guys. This is something new. We're offering, so the point of service, 30, 1,000, 20, 4,500. I mean, it's a lot, mouthful to say. Similar to what you have today, actually. It's got a $1,000 deductible for an individual, $2,000 deductible for your family, has primary care co-pays of $30, $50 for a specialist. So those are in front of the deductible. So the 30 and the 50 is in front of the deductible. The 100% preventive care is in front of the deductible. Where you're going to start getting into your deductible is if you go into the hospital, have outpatient surgery, have outpatient diagnostic testing, those types of things, that will be subject to that $1,000 deductible and then an 80-20 co-insurance split. Anthem's going to pay 80% of the bill, you're going to pay 20% of the bill, until you reach an out-of-pocket maximum of $4,500. So to give you an example of that, you have knee surgery, and the knee surgery was $16,000. Of the $16,000, you're going to pay the first $1,000, so now that's $15,000, and then 20% of the $15,000 until you have spent $4,500 out of your pocket in one calendar year. Does that make sense? Yep. Yeah. Correct. Yep. The prescription drugs for this plan is a 10, 40, 60, or 20%. So how that works is $10 is your generic. The 40 is going to be your second tier. The 60 is going to be your third tier. 20% is specialty drugs. So that's the Harbonis and the Hep C drugs that are on the market today that cost hundreds of thousands of dollars. If you were taking one of those drugs, your maximum cost would be $250 per drug, which is a deal if you have a $15,000 prescription that you're taking. It does have mail order. It's 2.5 times the copay, so it gives you a little bit of a break, but it's not a huge break. But you do have that option. You also, guys, have the option of getting a 90-day supply at a retail pharmacy as well now, whereas you, in the past, you couldn't do that. Any questions about that plan? That is a traditional plan, and it is not an HSA qualified plan. The plan right next to it is an HSA high deductible qualified plan. So what that means is that you can open up a health savings account if you enroll in that plan, the $3,000, $0, $4,000 plan. So let me explain to you how that works. Your preventive is covered at 100%. So all of those things we saw on those first slides, plus a whole host of others on the IRS website, if you go out there and look at it, are still covered at 100%. If you use the Live Health Online with this plan right here, it's a $49 copay. You don't have to satisfy that deductible. Everything else, you have to satisfy the $3,000 deductible. Primary care visits, specialist visits, surgery, inpatient, outpatient, everything is subject to the $3,000 deductible. Okay?
Give an overview to everybody why you might choose an HSA versus a standard plan?
Yes.
Because that's a new concept.
Yeah, it is a new concept. Well, the first thing, the biggest thing is the premium savings. You'll see the difference in the premium between the traditional plan versus the HSA plan. There is a big difference between those two. The second thing is you can open up that HSA account and start growing money. It's not like a flexible spending account. It is an account that, one, belongs to you. So you take it with you if you were to leave here tomorrow or next year or next week, whatever. Rolls over year to year. It grows interest, a little bit of interest, but you can put money in there pre-tax and it comes out tax-free for all qualified medical expenses. So it's actually a very, very good option. And if you take a look at the out-of-pocket maximum, it's less than the traditional plan. It's $4,000 versus $4,500.
And that's why it's so attractive to everybody. HSAs, my wife, Brenda, joined Stantec, 23,000 employees, most of them on the HSA, and it was new to me. That rolling over year upon year, use it when you have to. It's amazing when you can grab that credit card they give you, which is your money, but you can pay prescriptions instead of having to dig it out. It doesn't, if you will, you don't have to write the check for it then and there. It's just you use that. You stay relatively healthy, and when it comes up, you have that money. That's what's good. You know, it's not something unexpected. It's just use the card. It's almost like somebody gives you a Visa card.
It is
500 preloaded. It's really nice. All tax deductible, you know, because you're not paying on it. So it's just an alternative, but it's new, but it really works in most plans to your favor.
Yep. So you might be asking how, if you're out
That's
of
a sick
pocket,
employee right there.
if your out of pocket maximum is $4,000, but your deductible is $3,000, how do you get to that $4,000? Bingo! She gets the prize. Exactly. So once you spend $3,000, your medical expenses are 100% covered. Then you just have to meet that additional $1,000 with your prescription drugs. So, and it's less out of pocket than that traditional plan, and it's cheaper premium. And it lowers your taxable income for you. If you're going to elect to do $25 a pay period or a month or whatever the case is, that $25 comes out before your FICA tax is due. So it's a great option. And
Consider taking the less amount coming out and put that difference right into an HSA, in other words.
Correct.
If you're looking at, 100 coming out every pay, you can go with a $50 option, be disciplined enough, take the extra 50, put it in your HSA automatically. It builds up, though. That's what's
It
nice.
grows,
And you
yeah.
don't even know until you need it, and that's what's magic, especially with kids.
And the other thing about it is, you don't have to use it for little things. I mean, if you got a prescription that's $25, you're like, I'm not going to use it. I'll just let that money sit there. And you can keep your receipts. And then if you ever wanted to reimburse yourself for that $25 that you paid for out of your pocket and didn't use the funds out of your HSA, you could. You can reimburse yourself. You just have to be diligent about keeping your receipts so that you can prove it if the IRS ever came to you and said.
And that's a key thing to mention as well. If you have a husband or wife that goes and gets some service, they didn't have your card, they get the bill. Well, I paid it on Visa. I'm sorry. Well, we have an HSA. You take that receipt, you submit, you get your money. So you don't lose ever. And that's a convenience. Most people, I've watched couples that sit there and say, yeah, she spends terrible. And I've got this HSA, which has $3,000 in it. And it's like, take your receipts, get your money back. And they look like I gave them early Christmas. It's a big deal because that's your money. Use it. And it's very convenient, especially with prescriptions. Everybody forgets 25, 50, 30.
Yep.
At the end of the month, you're like, hey, I can give myself back $150. Great. It is the rage in healthcare.
It absolutely is. And it is the direction that companies are moving because of the rate creep with, health insurance premiums going up every year. More and more companies are, 3/4 of my clients today only offer HSA accounts, high deductible health plans. They don't even offer traditional plans anymore. They're going by the wayside.
Quick question, if I could.
Yep.
So the total dollar amounts coming out of the employee is, number one, your premium, which goes directly to obviously the insurance company. And number two is how much money I would like to take out of my paycheck to go to the specific HSA account.
Correct.
That's the form that I sent over this morning.
Yeah.
I sent over that.
So you have a pre-tax form that you're going to fill out where you're going to elect which plan you want to enroll in. And then directly under that is an option for you to elect a certain amount of money to go into your health savings account each month or each pay period, however you want to do it. And then that will be set up through payroll, so that money will come out first and go into your HSA account before your taxes are taken out. And you could change that. You're not locked into that. So if you decide, you know, on January 1st, you just want to do $25 a month, but then you're finding, hey, this is not so bad, maybe I can do 50, you can change that whenever you want to. You can increase it or you can decrease it. It's just a matter of letting Billy know so that she can take it to payroll so that they can make that adjustment. Did that answer your question?
So if you want to spread the $3,000 out, you would just simply deduct $250 from your monthly paycheck, and that's paid for, and you're done for the year.
Well, actually, you have, and we haven't gotten to that slide yet, but the annual IRS maximum for 2019 is $3,500 for an individual. So you can put up to $3,500 into that account annually.
I think most of us, one of the fears that I know that a lot of people have with HSAs, and I've talked to quite a few of them, is the family plan. Most people at Hobbs have families, so we're looking at the $6,000, you know, that is going to have to come out of people's pockets, and the first year is probably always the scariest because, you know, if it's coming 100% out of your pocket up to $6,000 for medical, you know, the first month you got $200 in your HSA and you get hit with a massive bill, you know, and you don't have anything in your HSA, that freaks a lot of people out.
Well, and that's true. I mean, you got to wrap your mind around that, the concept that could happen. I mean, you could start out January 1st and have a major surgery that you know, it's going to be $15,000 and you don't have, obviously, that money in your HSA account or even the $3,000 to pay for your deductible. But all doctors, hospitals, facilities will work with you and set you up on a payment plan. So as scary as it sounds, you know, it's not that terribly scary. And the other thing is these plans have embedded deductibles. So what that means is no one member of the family is going to have to satisfy the family deductible. So I'll give you an example. You have a family of 5 people, and I break my leg, I need to have surgery, all this jazz, I meet my $3,000 deductible. Then for the rest of the year for me, my medical is 100% covered. The remaining 4 members of my family have the additional $3,000 to complete the family deductible. So it's not as scary as that, because if you have one member that's just kind of really sickly, once they get to their $3,000, then you're 100%. The remaining family members have the additional $3,000 to get to the 6 total. Does that make sense? You're looking at me
So if I've got 3 kids and a wife, and each one of them has to get to 6,000?
No, not at all. If you have a wife and 3 kids, and let's say your wife goes in for major surgery and she meets her $3,000 deductible, all of her follow-up from that surgery going forward for the rest of that calendar year is covered at 100% for her. Okay? But then your son breaks his leg and your daughter does something else, they will have a $3,000 total deductible to meet, so that once you get to the family 6,000, everybody's 100% covered.
Okay. So once you hit 6,000, you're done.
You're done for the year.
So essentially, you want to make sure that, and this is for everybody on the code, because one of our contractors is 100% HSA. So I had a long, lengthy conversation with them. You want to make sure you have at least 6,000 in there to cover, moving forward, to make sure you got everything covered. Now here's another question: is what's the maximum amount you can have in your HSA?
The maximum amount you can put in annually is $3,500 for an individual.
Right. Yeah, I understand that. But what if you're a very healthy family and you've got $250 or $300 a month going into the HSA? I've known people who have $10,000-$15,000 in the HSAs. What's the total?
There isn't.
Okay.
There's no limit. You can grow that thing to $50,000, and when you're 65 years old, take it out, buy a boat, just pay ordinary income tax on it, and you're done.
Well, unless you have receipts that total $50,000.
Do what?
Unless you have medical receipts that can total $50,000. Then you can pull the money out tax-free, correct?
Correct. Yeah. So if you never use it and you just keep all of your receipts, you absolutely can reimburse yourself that $50,000.
Okay. Yeah, the interesting thing, and this is something that Hobbs maybe can think about, in talking with Southern Air, who's the contractor who's completely 100% HSA, they used to have multiple plans like this, and then went strictly HSA because they found that it was a better deal for everybody. They found that they could, in general, save the company about 30 to 40% over the conventional plans, and they actually took the savings that they were having to contribute and actually put that into the employees, I think to the amount of like $2,000 into the HSA every year in certain amounts, because they found they were saving so much. They just moved 100% HSA and then actually helped the employee out by contributing to that HSA pool of money, so to speak, every year. So, it's just something that they did. They found that it was a very viable plan, and it was very similar to what we've got here.
Well, and that's ultimately, I think, the goal here as well. And as I was saying before, the majority, like probably 90% of my clients, are all in HSA plans and don't offer any traditional plans anymore. And when you get to that point where you can do that, and then the company is seeing savings, they can pass that along to their employees by dumping some money into their HSA accounts. So, but that's the goal. I think that's where we want to get to eventually, but we didn't want to come in here and just say, all right, HSAs across the board, and don't even give you the option, because we understand it's a scary concept if you don't understand it. So,
what was the $3,500 figure? What was that?
It's right here. So basically, guys, these plans mirror the other plans. This is just on the national network, the PPO network. Okay? Same exact plans, same out-of-pockets, deductibles, everything. Just two different networks.
I wanted to make one question regarding the scary first few months. If you have a major thing happen in February, that's the $3,000 event, would that go to this card in a credit and you would pay it off, or it's purely a bank account?
No, it's purely a bank account. You're going to have to pay, you're going to have to deal directly with the doctor, facility, whatever, in regards to making that payment. But you can't, it's not like an FSA where your employer front loads your election at the beginning of the year. It's not like that. If you don't have money in the account, you can't spend the money.
Bryce will float you a nice loan at a nice healthy interest rate, Tom.
What did you say?
And the other thing is I've had major surgery this year, and the doctors work with you to pay off the bills.
Yeah,
Don't worry
they
about
do.
it.
I mean,
That's a month and you're golden.
everybody, yeah. I don't know of any hospital or doctor that doesn't work with people and put them on a payment plan, you know. So
Another question or another comment. In talking with the guys at Southern Air, what they also recommend, and maybe you can comment to this with theirs, I think they've got Signet is who they use, I think. But they all recommend don't pay when you go to the doctor, don't pay anything at that time because you wait for the bill to show up because the bill gets negotiated on the back end.
Absolutely.
And so I'm assuming that's what you guys do is to work with the doctors or the healthcare, whoever that is. So, you know, you go to the doctor, it's not $120. It goes through and, you know, the insurance company says, no, we're not going to pay that much. You know, you're only entitled to $85. So then you get the bill in the mail and it's only $85 instead of paying a certain amount at the doctor's office like a copay or anything like that. HSA is a little bit different.
That's correct. And that's another reason why you want to register on Anthem.com, because you can look at those claims coming in real time. But yeah, you don't want to pay anything at the doctor's office. And when these plans were first introduced, 2010 or whatever it was, doctors were demanding, oh, you have to, I need a copay, I need something. And you tell them, hey, I'm on a high deductible health plan, I don't have a copay, I don't know what the amount's going to be. And they would make you pay $25, $30.
Yes.
Today, that's not the case. Most doctors, facilities, they understand how HSAs work now. They file the claim with Anthem. They are a contracted provider of Anthem. Anthem negotiates that rate, so it's $175. Anthem says the contract's going to pay $85. You're going to get a bill for $85, not the $175. And that $85 goes towards your deductible. Does that make sense?
Okay, I have a.
Oh yeah, absolutely.
Can we just drop $3,500 into our HSA membership for the year?
So that's a very good question. So if you have $3,500 sitting in a savings account today, and you want to get it into this HSA account to start building it, and so you'll have it if you need it for any medical expenses, you absolutely can do that. And when you file your taxes in April, there's a line item on the tax form that you can take that dollar amount off. So you still get the tax benefit of it, even if it's not payroll deducted. It's a great question. I actually have a slide on that. Who is eligible to have an HSA account? Well, first and foremost, you have to be enrolled in a qualified high deductible health plan. So you can't be in a traditional plan and have an HSA account. You also can't be on your spouse's medical plan, your spouse's flex spending, because they look at that as a double dipping scenario. You can't be on any part of Medicare or TRICARE, okay? So I don't think anybody in this room is Medicare eligible, but a lot of times that gets confusing for people. They think they enroll automatically in Part A and that they can still have an HSA account, and you cannot do it. You can have the account, you can't contribute to it anymore. So there are some rules behind this. The other piece is tax dependence. So we can keep our kids on our plans till they're 26 years old, right? They can be married, doesn't matter, living in their own house, and still be on our plan till they're 26. If that child is still on your plans, 25 years old, working, filing their own taxes, you can't use your HSA funds to pay for their medical expenses. They have to be a tax dependent. Okay? Just keep that in mind.
Keep them unemployed.
My daughter is away at college and working and filing her own taxes, and without even thinking, I was paying for her medical stuff out of my HSA. And I'm like, wait a minute, I can't do that. She's filing her own taxes. So keep that in mind. They have to be a tax dependent. Okay? You can use it to pay for any qualified medical expenses that the IRS says is a qualified medical expense. You can use it to pay for your deductible and out-of-pocket maximums. You could use it for prescription drugs, dental expenses, vision, LASIK surgery, acupuncture. I mean, there is a whole host of things that you can use it for. Big thing, over-the-counter medicines, no, can't do it anymore. When they first came out, they allowed it. They will not allow it anymore. So if you are going to get this cough syrup, Delsum, which is the best cough syrup on the market, you can't use it to pay, you can't use your HSA funds to pay for it. Unless your doctor writes you a prescription for that Delsum, then you can, okay?
How about that health?
How about the what? That's a good question. I've never had that. I'll have to research that. If you get, yeah.
If I get a
the medical marijuana. I mean, I don't know. That's a really good question.
That's glaucoma kicked in.
If you retire, you take the account with you. It's your account. It does not belong to Hobbs. It's 100%. You're 100% invested immediately. You can, if you retire, you're on Medicare, and you have, $10,000 still in that account. Like I said, you could take it out, pay ordinary income tax on it, or you can just spend it down. Use it for your medical expenses. You can also use it to pay COBRA premiums. So if you were to leave here and go to work for somebody else, and you had to have COBRA in the interim, you could use the funds in your HSA to pay for your COBRA premiums until your new plan kicks in with your new employer. Keep in mind, if you do go to another employer who does not offer a high deductible health plan, you can't make contributions into your HSA. That is the number.
Quick question on terminate or retire. What if you die? Your spouse get it?
If you are going to have a beneficiary on file, that's correct, and those funds will go to whoever your beneficiary is.
10-4.
So if you have I have a wife that's a school bus driver in the city of Virginia. She has a great medical school bus driver in the city of Virginia. She fills out with autism. And she's currently got coverage on different things. So she really doesn't pay anything when she does have medical procedure. If I do multiple high deductible plan, can I still take some of that funds to help pay for whatever she may have to have a procedure, or because she's double covered, she can't do it?
No,
That's not
if she's your tax dependent, you can use the funds to pay for her medical expenses.
tax dependent, or we file jointly, so I'm just wondering how this.
Well, you file jointly, yeah,
Yes.
yeah,
Okay.
file jointly.
Okay.
Yeah, they don't have to be on your plan. They just have to be a tax dependent. But they can't have a flex. They have a flexible
I
spending.
gotta find that out. I don't know if she's got it.
Then you can.
Okay, I'll find it.
So 2019 contributions, again, we already talked about this. You could put up to $3,500 if you're single, $7,000 if you're a family. Part of Trump's plan is he wants to increase this to like $12,000 and $14,000, which would be awesome for us. I don't think it's ever going to happen, but those are the limits. If you're over age 55, they will allow you what's called a catch-up contribution. So you can put in an additional $1,000 in that account annually. And if you over-contribute, you will get charged a penalty of 6%. So make sure that you're not putting $3,600 in there. You're only putting the $35 or $34.99.
Quick question on the threshold for, the total out of pocket. Let's say your medications and miscellaneous doctor bills and everything are coming in. How does the insurance company know when we've hit the threshold? Do we have to tell them and prove it?
No, because the claims have to be filed with Anthem. Anthem has to adjudicate those claims before they tell you what your responsibility is. So that's all tracked. Everything is tracked in their system. And
even what about medications and stuff that you're buying at Walmart?
Everything.
Okay.
Yeah. I mean, unless you're not running it through your insurance. And in some cases, you might not want to do it because it's cheaper to not. Like, for example, Walmart. They have these deals where certain prescriptions are like $5. If you ran it through your insurance, it'd probably be $15. So you can make that decision. You don't want to run it through your insurance. But anything that is run through your Anthem for you is all tracked. And you can keep track of it all online on their portal.
Okay.
Including your ActWise HSA account. So what's cool about this account is it's integrated with your medical. So if you log in and you see you have a bill out there from Dr. Spot and it's $35 and you want to go ahead and pay it directly from there, you can absolutely pay it directly from your ActWise account to Dr. Spot. It's all integrated. It's very cool. So you want to make sure you're absolutely registered online. Has anybody heard of this chip process before? This is where they validate that you are who you say you are. So first thing I want to tell you is when you go into, if you enroll in the HS high deductible health plan, you're automatically going to be opened an HSA account. It's automatic, okay? If you fail the chip process, which means they can't verify your identity, they're going to send you a form in the mail asking you to verify your identity, and it's very important that you do. And it's going to be like probably a mortgage statement or a bill or whatever the case. I don't know what the qualifiers are, but you're going to get something in the mail that you're going to have to send back to them if they cannot verify your identity. A note from mom. If you don't send it back, they're not going to open up your account. So it's very important. This happens like 1% of the time. But just to let you know that it quite possibly could happen. And if it does, you have to get that information back to them as soon as possible. This is the debit card that you'll get. So when I say you're automatically enrolled in the HSA, guys, if you don't want this health savings account, you need to actively close it, okay? It's automatically going to be opened if you enroll in the high deductible health plan. If you don't want it, you know you're not going to contribute to it, actively close it because there is a $2.25 admin fee a month for that account. So the other piece of that is you also want to opt out of paper statements because they'll charge you $1.50 for a paper statement. So if you don't want the account, actively go online once you get notified that your account's been opened and close it immediately so you're not charged the $2.25. If you do want the account, go online, opt in for paperless so they don't charge you the $1.50. Okay? Any questions before we move on to your dental plan? Man, you guys are good. All right. Nothing new here. You're still going to be with Anthem. The plan, we just incorporated and enrolled in the Pace Adams employees. So now we're in a larger market, so the benefits are a little bit richer. You have a $50 individual deductible, $150 for a family. So if you have a family of 6, the maximum is $150. Okay? Cleanings are covered at 100% in network. So make sure you stay within the network if you possibly can. That's everything that they do at your exams. Everybody get their teeth cleaned twice a year? Yeah. You're not doing that. You need to be doing that as well because they can detect all kinds of things by looking in your mouth. You know, that's why they pull your tongue out and they're looking around.
Oral cancer.
Oral cancer, diabetes, heart issues. They can tell so much from doing that oral exam. So make sure you're doing it 2 a year, covered at 100%, no cost to you. Basic services, which are going to be your fillings, your extractions, endo, periodontal. It's a $50 deductible. Then Anthem pays 80%, you pay 20% of the bill. Major services, dentures, crowns, implants, those types of things, $50 deductible. Anthem pays 50%, you pay 50%. Crowns are very expensive. I don't know if anybody in this room experienced that. And you have a bucket of $1,500 annually. That's a rich bucket. Most employers offer a $1,000 bucket. Okay, you guys have a $1,500, and your preventive does not go to that bucket. So that's just your basic and your major services. And ortho. If you have a child that needs dentures.
Braces?
Braces. If you have a child who needs braces, there is a $1,500 lifetime maximum for that. So I know $1,500 is kind of a drop in the bucket when it comes to braces, because they're like upwards of $4,000, $5,000, $6,000. But at least it's something. It's better than nothing. So, and again, the dependents can stay on until they're 26 years old, even if they're married and have children. Questions about the dental? Today. Okay, so let's talk about housekeeping and paperwork, because this is very important. These plans are all going to be effective January 1st, 2019. So that's literally what? 2 weeks away. Okay? Everybody, this is a mandatory enrollment. Everybody has to complete a pre-tax form. Everybody has to complete an application. And everybody's got to get it in to Billy by the 26th.
No exceptions.
No, I mean, because here's what's going to happen, guys. And this is not even a scare tactic. This is serious business. December 31st, Anthem is going to be canceling Hobbs 3 medical plans that you're currently covered under today. They will be terminated at midnight on 12/31. Okay? New Year's Eve. Anybody going to a party?
I'm gonna drink my deductible.
So if you don't have an application, if you do not turn in an application and a pre-tax form to Billy so that she can get you enrolled in the new plans effective January 1, you're not going to have coverage. So don't go to Billy and say, hey man, I didn't get my ID card right. You're canceled. You don't have coverage. You will not have coverage 12/31 if you don't turn in your paperwork to Billy. This is a major process that we have to go through to get 50 people in an enrollment spreadsheet with everything absolutely accurate, so we can upload that to Anthem so you guys can be in the system within 24 hours. But we can't do that if we don't have the applications turned in time, clean applications. And by clean, I mean legibly write everything. Don't leave anything blank. Especially dates of birth, dependent information, social security numbers, dates of birth, all of that stuff. Because if you turn in an incomplete application, and you turn in an incomplete application, and you turn in one, that holds up everybody's cards. We can't submit this enrollment template to Anthem unless it's absolutely complete. So I'm not trying to scare you, but this is a true story. The other thing I want to point out to you guys is if you have any prescriptions that need to be refilled, try to get them refilled before the end of the month. If you have any doctor's visits scheduled for the first part of January, try to push them out, because there's going to be hiccups and we are not going to have cards in our hands January 1. It's not possible. We're hoping that we could at least get temporary cards by the first week of January, second week of January. So please be patient with us, because this is, again, it's a process. And we're looking at 150 people that we got to get into the system and get cards generated for. So prescriptions, try to fill them before the end of the month if you need them, if you know you're going to need them the first part of January. And doctor's visits, if you could push them out to the end of January, that would be the best thing. Or move them up to before 12/31. Questions?
I think it might benefit everybody if you gave kind of an overview, pro and con, if you will, about the difference between what is the Key Care, the National Blue Cross Blue Shield, versus you know, the local Virginia one, just because there's two rate structures. A lot of people say, well, if you live in Virginia, or if you're in Tennessee, or one of these other areas we're in, why would it matter to look national versus a local coverage? That might benefit people here. And I know a lot have asked me, why wouldn't I just choose Virginia? Seems logical, but there's benefits.
Well, if you don't live in Virginia, you can't. So the Tennessee people, the Florida people, they can't enroll in the Health Keepers plan because there is no network in Tennessee. There's no Health Keepers network in Tennessee, and there's no Health Keepers network in Florida. Health Keepers is regional to Virginia. It's a local network. The Key Care network is on the national level. So that is Tennessee, Florida, California, anywhere, everywhere. They have, if you're on the Blue Cross Blue Shield network, Blue Cross Blue Shield of Tennessee is going to be different than Virginia, but they reciprocate. So they will give you benefits as if you were in Virginia. So it's a national network. If you don't live in Virginia, you can't enroll in the Health Keepers network because you wouldn't have coverage. If you are in the Health Keepers network and you fly out to California and you get sick, you don't have coverage. You don't have coverage. You would pay for it entirely out of your pocket because there is no network. It's a local regional network. Unless you do the Live Health Online, and then you do. Absolutely. That's why that Live Health Online is so awesome. Is if you are on the Health Keepers network and you do any traveling with your kids or whoever, you have at least that option that you could, still get a prescription out in California if they could diagnose you through that FaceTime phone call.
That's a key thing to think about. A lot of folks have asked me, imagine us traveling a lot or your children.
No, not in that scenario. If you have a true emergency, then you are covered as if you were in Virginia. Yeah, so the question was, you get in a car accident, you break your leg, you're in another state, is that not covered? That would be covered. It's a true emergency. So anything that is a true emergency, you will be covered as if you were in Virginia. But a sinus infection is not a true emergency. No, I mean, well, that you know what? That would be a case-by-case determination by Anthem. I can't say if you were out drinking and you fell and busted your head and you had to go to the emergency room because you thought you had a concussion. I can't make that determination that would be a true emergency. That would be an Anthem determination. Yes, that's correct.
What was your question?
Who decides if it's a true emergency? Anthem. I mean,
You could probably fight that too.
I mean, yeah, absolutely. There's always appeal processes, but yeah, you pretty much know if you cut yourself and you're bleeding and it's not stopping, that's an emergency. You got to go seek medical care. If you have a sinus infection, that's not a true emergency. So. Any other questions, guys? When do you have to have your paperwork in by?
26.
No later than the 26th. Sooner the better.
Going out on Christmas Day, guys. 26.
I have a question.
Yes.
Okay, under the application, you have employer's name. We're supposed to put HT Holdings in there, correct?
Correct.
Okay, group number.
You don't.
And
we don't have that yet.
okay. If we're doing the HSA, you choose Health Keepers Incorporated and not the Anthem, Blue Cross, and Blue Shield.
So are you going in, you're going into the Health Keepers plan, so it would be the Health Keepers?
HSA.
Correct.
All right. If you have kids under 26 that happen to be in Oregon and Idaho, can they get their own? They'll be covered, but what you said is I cannot use cannot use my HSA dollars for that.
Are they your tax dependent?
Oh my God, what a hell of a question. Sorry about the dog.
Are they your tax dependents? Oh, he muted.
Could you pick up the dog? Thank you. Tax dependents. Okay, that's a better way to put it. One of them is completely off my payroll. The other one is semi off my payroll, so he would still be a dependent. So it depends on that solely, correct?
Correct. And,
thank you very much.
And if you enroll in the Health Keepers plan, and they are wherever you said, Oregon, are they going to school out there?
No, we have one that is fully off the payroll, but we just keep him on it because he's under 26. Just in case.
Okay.
But are you claiming him as a dependent on your taxes?
I cannot, no. So that's when I can't use that HSA money to spend on him. I understand that.
Correct. And let me also address this with you guys as well. If you do enroll in the Health Keepers plan and you have a child, a college student that is going to schools in another state, if that state offers the guest program with Health Keepers, which most states do, you can get them on the guest program and they will be covered as if they are in Virginia. So if any of you, not necessarily. Mm-mm. It's on the website. Yep, it's on the Anthem's website. It's pretty much every state, I want to say, most states. Puerto Rico wasn't. I just found that out recently. Yeah, probably not. Yeah, I don't know. But it's on their website. And if you can't find that information, reach out to us and we will go directly to Anthem and get that information for you. Mm-hmm. Yep. Hello? Absolutely. Yes, it will be available, and it's also being recorded. So it can be pushed out to your employees and they can listen to the presentation and then follow along with the PowerPoint as well.
Under reason for application, are we considered new enrollment?
Tom, hold on.
I'm sorry, say that again?
It'll be shared via email to all employees.
Via email to all employees. Correct.
All employees, yes.
You're welcome.
Tom, you're it.
Under section 2, reason for application, it says you have the option of new enrollment or annual open enrollment. Is this considered new enrollment?
Yes.
Thank you.
So there is, when you guys get to the vision section that Billy grayed out, we don't have you can check exam only. You don't have to. It's embedded in the medical. So you don't have an option to choose it or not choose it. It's embedded in the medical. You get one eye exam at a $15 copay annually. Okay? And then there are discounts, various places, Costco, Walmart, different places like that, will give you an additional discount for being an Anthem member. So you show them your ID card, and you can get up to like 20% off of frames, lenses, those types of things. But the vision is automatic. You're going to get one eye exam a year.
Under dental coverage, it says prime essential choice or complete essential choice. We only went over one dental option.
Yeah, it's complete essential.
Okay.
That's because Anthem offers a prime and an essential, and you guys are getting the essential. Any more questions? I will hang out if you guys do have specific. Okay. You got it? Okay. Yeah, definitely get all of your prescriptions. If you could possibly get them filled prior to the 31st, that would be awesome, because it's probably going to be mid-January before we can get cards pushed out to everybody. That doesn't mean that I wouldn't be able to have access probably to an ID number for you guys that I could give you, but I'm just telling you to be on the safe side, try to get those things knocked out before the end of the month. Any other questions? All right, well, thank you guys for your time and attention.